I'm curious as to this man's angle, whether or not our friend Ted, Dr. Ted Bailey from GBMC, Dr. Ted, if I can call you Dr. Ted, you heard the hard question that was asked. You heard the hard question that was asked, and you're here with the hard answers. Are you a heavy pulp, light pulp, or no pulp guy?
I have to say I'm heavy pulp.
Heavy pulp. Wow. Heavy pulp. Dr. Ted C. Bailey from GBMC joining us on the phone. In times like this, with the coronavirus running rampant, all right, running wild on the WWE, is this the perfect time to just start hammering OJ, which I've always been told the vitamin C, boost your immune system, less colds, less flus, whatever. Is that going to help at all, or is that like bringing a toothpick to a nuke fight?
It's a little more like a toothpick to a nuke fight, which isn't to say you shouldn't have a toothpick on. Well, don't go without a toothpick. That's even worse.
Okay,
but
you're right.
Don't expect it to have some miracle medical powers.
Yeah.
Now, if I'm cutting that toothpick in half with champagne, is that even worse?
That actually tastes better, but might actually be worse.
Yeah. Hey, where do you stand
it's
on the whole,
Dr. Bailey. He is, Dr. Bailey from GBMC. He is the chief of the Division of Infectious Diseases. And, of course, we are talking about coronavirus. Where are we at, Doc? Where are we at?
Well, where we are is in the middle of a fire with, I think, some of the rooms getting put out, the fire's coming down. But like any fire, if the fire isn't completely out, it can come back into rooms that haven't caught on fire yet. So I feel like there's signs that the work is working, and we're seeing fewer cases in some areas, but we're still seeing new cases, and there still are cases, and any of those cases could cause more spread.
Yeah. Inside of Josh's news, we've heard last week into this week, people are starting to get a little cabin fever, I think, locally, nationally. And the question is, when does this end? When could it end? When should it end? And I think, Josh, today I heard in your news that, and I think this is a phrase you're going to start hearing more and more of as the reopen the country, should we, can we conversation continues, is second wave. Second wave. If we do this too soon, is there going to be a second wave? That's a real concern, right?
That's a real concern, and that's even why I led with the burning house metaphor, because there's a couple ways that people might be tempted to think about this. They might be tempted to think about it like it's bad weather. And if a hurricane has come and actually has gone, right, then you come out, because coming out doesn't bring the hurricane back. But if what you're dealing with is a burning house and you've been able to get one of the rooms out, and there's still some fire and you've got rooms that haven't burned yet, those rooms are still fully able to burn in. And if we have people who've not had corona yet, and we still do, that's part of the success of where we are right now, they're still fully vulnerable to it. And if there are still cases throughout the country, and there still are, those cases can spread to those people.
It is so frustrating to me and to a lot of other people because it's not a black or white situation. There's a lot of conflicting information. You got different states, governors saying one thing, other governors saying another thing. You got the president saying one thing. And from what I've been reading, certain things have to be done before you can have these restrictions lifted. And if you were in charge, would you start lifting these stay-home restrictions at the when the guidelines expire at the end of the month?
I would not, just based on medical background and experience and being an infectious disease doctor, because that's not the way that a respiratory virus like this works. What we're often more accustomed to is the flu. And the flu, quote unquote, runs its course every year. But one of the reasons it runs its course is because it actually does really essentially spread throughout the country to everybody. And there isn't anybody left who might still get it. And that's what we can't allow to happen with this much deadlier virus. So I would be holding them in until we've really broken the back of the virus and there isn't any further transmission.
Now, how do you what kind of timeline are you looking at? I know you're not psychic, but what are you looking at? June, July, when you could really, if you wouldn't lift these restrictions, are you saying you wouldn't do anything different at the end of the month? You would keep it as is? And if so, when would you start rolling them back?
I think one of the things it's a bit frustrating. It's probably the most frustrating for the most compliant individuals because they've been doing what needs to be done longer and better than anybody else. But our ability nationwide at the level of each individual household has not been perfect. There hasn't been perfect compliance, and so right now we are seeing some benefit from this as it starts to come down. And what we would expect is that there's fewer cases now as possible sources for the next set of infections, and people stay in their houses and stay with social distancing. We would expect in a 2-week time frame, because that's the incubation time, fewer cases still, and we would have to take those numbers on a 2-week basis and basically see where we're going. But where the numbers are headed, if I was to look at the trajectory, there's not going to be no cases at the end of this month. And if you simply put that back out there, open movie theaters, open restaurants and things like that, and allow, with knowing that there's still cases, allowing them to go back into those mass spaces, you would expect this to just come right back up again, just like the hurricane turning around and U-turning, except, again, this isn't like weather. It's more like a fire.
Dr. Ted Bailey joining us from GBMC, Chief Division of Infectious Diseases, obviously talking about the coronavirus. It seems like what the entire world is and has to talk about. And the knowledge and the insight and the information that we have about the actual virus itself, it seems like it changes and grows every single week as, specialists like you learn more about it, because initially, it's no more harmful than the flu. Oh, don't worry about it. It's only people that are extremely old. Oh, it's just people that are old and have underlying conditions. Now you hear if you have heart issues, you have asthma, then you start hearing about people that are the pinnacle of health, like marathon runners. There was a story about a guy that won the Boston Marathon, or was like a top 5 finisher or something, who is at death's door with 0 underlying conditions, that this thing, put this person against the ropes. Where are you at on understanding the capabilities and the viciousness of this thing? Do we have a more complete picture of the coronavirus itself?
Well, we have a growing picture, but I think one of the things that we need to operate with what we know, but at the same time, we shouldn't believe we know as much about it as we know about more established infectious diseases. So there's active clinical trials. There's still active gathering by public health authorities and compiling and sharing that information so we can learn more about it. One of the things that we've been able to learn more is sadly because we have more cases to study. In China, where it began, we initially had far fewer cases worldwide. And so we didn't have as many cases of young, healthy people getting it and becoming severely ill. We knew that the percentage was lower, and it remains lower for them to become ill. But as you increase the actual number of people who are healthy who get it, and they're the ones who are more active, more out and about, more likely to get it in some sense, you're able to actually see that happens. You're able to, and then you're able to study that better. You're able to understand what you can do for those people. The older people were more vulnerable, and you would hope that they would be more exposed to it, but we know it gets into places like nursing homes and sometimes runs rampant there. And we're better able to learn how it affects them and help them as well.
Talking to Dr. Ted Bailey, the Chief of the Division of Infectious Diseases at GBMC. Is this a glimpse into the future of what we can expect with global pandemic? Should we be worried about, the next 5-10 years of another one like this? And are we going to have to go through everything we're going through again with all these shutdowns and lockdowns and all that?
Well, I would say that the answer is unlikely to be. It's not likely to happen again in the same scale. This is an outlier. In fact, if you were to think about viruses and outbreaks over the last 100 years, this one really stands apart. It really even stands apart from the measuring stick, which would be the 1918 influenza outbreak.
Mm-hmm.
That one still has bigger overall numbers, but it had more time to spread. You're talking about that season is over. We know what its win-loss total was. This one is still going, and it has the ability and the day-to-day statistics that would outpace that influenza. So that's not something we should expect even on a decade-to-decade basis.
Well,
and
insightful, Josh.
Doctor,
one more.
Doctor, what are you dealing with at GBMC when it comes to the virus patients?
I can't speak in specifics just because of at this level of information, you start to have patient privacy factors. But I will see that, we, like every other hospital here in the Baltimore area, are really seeing the spectrum of disease that we had been led to expect, which is to say some people will come in and they will have nothing more, God bless them, than a cough, some fevers, and it doesn't get any worse than that for them. And it isn't because of anything that we do. It isn't because of any medication that we give them. But other people, and sometimes they're not people that you will be able to distinguish up front. There's nothing different about them that you can tell right up front. Their need for oxygen increases to the point that they have to go to an ICU. They have to have even something as drastic as intubation. And we know from the national statistics, and we knew this going in, that not everybody survives when it gets to that level of severity, that the prognosis is very poor. Some of those people do turn around, do come out of the ICUs, do leave the hospitals. We don't know what their long-term functional status is. How well and how fully do they recover? It's still too early to say, but they've recovered to the point of not needing a hospital. So there's lots of different stories to be told.
All right, he is Dr. Ted Bailey, Chief Division of Infectious Diseases, GBMC, an excessive orange juice pulp expert. Buddy, we've appreciated the insight, man. We appreciate some of the hard facts and continue to do the good work that we know that you're doing over at GBMC. We appreciate your time.
Thank you. Cheers. Take care of yourself.
Take care.